Good.
Good afternoon, everyone. We will call the April 2nd, 2020 board meeting to order. We'll begin with the Pledge of Allegiance. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. All right. Welcome to all our listening guests and our Commissioner Burrell, who is joining us remotely also, and along with some other department heads. First I can say that we called this meeting because we had canceled the March 31st board meeting because we had five Tuesdays in March, but felt that it was pertinent to have this board meeting in case we have any updates or to finish some business that might come before us. So, and the first item of business is to review the minutes from the 326 Committee of the Whole. Administrator Kelly, would you like to do kind of a quick summary of those minutes, please?
I think I'm going to approach the bench if that works.
Oh.
This is going to be different.
Yeah.
All right, everybody at home, able to hear me okay?
I can hear you good there.
All right, perfect. Committee of the Whole met March 26th. We had four of the commissioners, three of the commissioners in person, Commissioner Burrell via telephone, and Commissioner Potter absent. A number of staff from various departments attended. So quick summary, we were discussing COVID-19 and the impacts on the board. Earlier that morning, we had heard that the state decided to close the driver's license, the DMV. I mentioned that we initially had scheduled the meeting on the 26th to discuss the decisions that were made for the period of March 18th through the 4th of April. The executive order was issued the day before by Governor Walz, and we were to discuss additional changes that we would like to make. The main first point we hit was that we recommended to stay the course that we had been and continue to have folks work remotely through the next pay period, which ends on 4/18/2020. We decided we were closing the building at 5 p.m. and would continue to do that. There would be no evening meetings. About the same time, the counters of the courts were closed on the Monday preceding this meeting. Staff is still available via phone, fax, and email, and will be working, but the public counters were closed. The court calendar has been cut back significantly. Mark Mattice provided an overview of the direction that he provided and the operations that are carried on at the Parks Department on some of the additional work that's having to be done, as we are seeing a high amount of utilization with the parks right now. Campgrounds are still set to open as of May 1st, and he's working on a plan for keeping that operating along with the swimming beaches. Goodrum Schwartz talked about the closing doors at the HSC as of Monday 3:30. Traffic will be directed to the third floor of the government center, and again, employees will continue to work in these locations, but the public counters will be closed. We did receive an update from Public Health Director Sarah Grossesh talking about the latest developments of COVID-19. Again, that's a very fluid situation. I would like to point out the hotline was discussed, 763-682-7607, and if there's questions, you can call that number. We talked a little bit about the supply chain of the tests and how it's very difficult to procure them currently. Talked briefly about some of the committees and things moving forward in logistics, including the Owners Committee, which have been canceled. After discussion, the threshold for approving change orders for Owners Committee items was increased to $20,000. If there's other additional things, myself and Alan will communicate that to the board. We also sent a letter stating that our construction sites are going to remain open and contractors will have the ability to decide if they're going to continue to work. We also talked about scheduling today's meeting that we're having now and future meetings potentially to discuss COVID developments as we have. We also talked a bit about essential worker letters to be provided to staff given the governor's orders, so that has been done. Sheriff Derringer talked a little bit about current number of calls being down given the current COVID moving forward, so that it's less than they typically have, and they're taking precautions related to medical calls and face-to-face interactions. So again, the discussion and consensus was to extend our current pay arrangement through the 18th of April. So recommendations, in summary, schedule today's meeting 4/2 at 3 p.m. and carry forward our current plan where as many county employees as possible to work remotely and pay to continue with the closure of public counters at the government center through the 18th of April. Quick summary of the minutes.
Madam Chair, I'll make a motion to approve the minutes and the recommendations from the March 26th Committee of the Whole.
All right. Motion made by Commissioner Patch, seconded by Commissioner Delyden. Is there any discussion?
Yes, Madam Chair.
Yes.
Thank you, Madam Chair. For some of the public out there that doesn't understand why, I had a couple of people question me, why don't you just lay everybody off? It's not quite as simple as it seems with this. And try to explain between union contracts, everything else, and who do you send home, who do you keep, who's you send, who's this, who's that. You make it a to people go versus just keep going and stay the course right now. I just want to make that in public here because the people that have called me and asked me about this, well, we're private, we're laid off, how come the government's still working? It's like, it's a different set of scenarios here. So kind of happy it's going that way. I wasn't here for that meeting, but I'm happy you decided to stay that course because I think it'd be more of a headache if we had started laying off people at this point for us. The other item is the with the Justice Center. That Tuesday I went back out there and I toured it with Mike Heave.
Oh.
Yeah. The Justice Center. Okay. We had to make arrangements for one of the contractors was on the go back out there, so they have a separate stairway for them, separate portable john for them, separate hand sanitation station for them, and it cordoned off so only they're the ones finishing in the courtrooms. They're the only ones in there right now, so that's that made them happy, and the rest of them are all still working, doing their thing out there. But they found a way to make it work to keep people working. Delay.
Yep.
Madam Chair, I think it just put under Mike's point there. I mean, there's still a lot of business that's being conducted. I appreciate Sean Riley and his update. I mean, just like since March 16th, we've already received 71 permits and 8 of them being commercial. They've already done 100 building inspections over the last couple of weeks. There is still a large amount of business that's being conducted. It's just being conducted behind the scenes, and I think it's important that the public realizes that. And if we did lay off everybody, we would only be building a bottleneck later on down the road that we'd end up having to possibly go into overtime just to get ourselves out of that bottleneck. So
Yeah.
I appreciate the staff in doing their diligence to try and facilitate as much work as they possibly can.
And certainly we have a lot of essential, duties that we're performing with our, Health and Human Services, of course, our Sheriff's Department, they can't shut down. I mean, we have probationers, we have a lot of people that are still needing the, our services, so we can't shut down, we're essential. Any other comments? All right, hearing none, all in favor, this will be a roll call vote.
Aye.
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 Charlie?
And Madam Chair, I could not hear the motion.
To approve the minutes and the recommendation from March 26th.
Oh, just approve the minutes, okay.
And the recommendations, Commissioner Burrell.
I think I was okay with them too.
The recommendations were to extend it out to April 18th, the current work situation.
Yep, I'm okay with that.
Okay.
All right. You vote aye?
Yes, I did.
Thank you. All right. Motion passes. We didn't have specifically a formal agenda, but there's something that was kind of related to the COVID, but not, it just came in yesterday, I think it was, to petition onto this meeting. And Jamie?
Actually, I'm over here.
Sarah? Jamie, Sarah? can come up
Sarah, you
here.
got to come up here.
Yes, sir.
Thank you. It
I'll
actually
sit
is
back.
related to COVID. It would be a position for the duration, part-time temporary position
Correct.
for 15 hours a week for a public health planner to do some data analytics while they're happening. Sarah does have somebody that would meet the requirements, and I did, an individual from Delano. I did speak with the AFSCME president who contacted the AFSCME Uber chief, and they agreed that this would be important for the county to proceed with the board's approval, and it is related to the COVID work that
Correct.
public health is doing.
Questions about that?
No, I was going to say if you had anything to add, it sounded like an important thing to do at this point to me.
Somebody just
And
mentioned the bottleneck, so it kind of seems like, public health, the bottleneck is like happening now as far
Oh, yeah,
as this.
for
So the
sure.
capacity,
Yeah.
we just want to grow the capacity. This would be an individual who would work from home. We don't see that there'd be any need for them to, come into admin or anything like that, so.
No, most of their work can be from home because they'll be
Yep.
doing data stuff. So there's an initiative between several counties to work with the University of Minnesota to start tracking, collecting information around the social and economic impacts of this. So I know that would be of particular interest to the board. So starting to compile the things that we want to know around, like for instance, how many people applied for unemployment from Wright County. Right now, we're not able to get that information. So having all of that compiled along with anything that we might be seeing across a wide spectrum of areas, including mental health, law enforcement, all of those things. So we can see some of those impacts of the stay-at-home order and see if we need to adjust some things.
Yeah, definitely. Anyone have any questions about this?
Madam Chair.
Yes.
Madam Chair,
Commissioner Burrell?
I'll wait my turn though.
Okay. Go ahead. Go ahead, Commissioner
Well,
Burrell.
I'm just wondering, because we do have a lot of people in public health, I'm just thinking it would maybe be a good opportunity right now to cross-train a couple people, because I'm sure there's other parts of public health that are not as busy as the position that you're speaking of. And I'm wondering if that would be a better way to do this.
So we need someone who can hit the ground running with data analytics. And in fact, I actually didn't, the other portion is that they need to be doing illness and developing a system for us to track illness in the community, because we know that our testing resources are very limited. We don't really have a good understanding of what kind of folks are experiencing that are symptomatic. And we plan on developing our own local system because the state isn't providing resources for that monitoring at this time. We have some, I agree with you that it would be a prime opportunity to cross-train. However, that's why we're looking at a limited amount of time with a part-time position to get that going, and then potentially we could bring someone on with afterwards or develop them along the way. But most of those folks still have caseloads or other things. Anybody that we could bring in has been brought in.
And just to jump on top of that, this is Jamie, Commissioner Burrell. To cross-train, we only have one public health planner now, so just getting into some union job descriptions, and not that that would necessarily happen, but to avoid that, I mean, this would not necessarily fall into the job descriptions of a
Correct.
public health nurse or a case aide or some other folks. This would pretty much falls into that public health planner role, and we only have one. And
Right.
I think Joel is very busy now.
Yep,
That's
yes,
a very good explanation.
yeah. Commissioner Potter?
And so what would, and you said Joel is that person right now?
Yeah, and he's the public information officer. He's the section lead for all of our communications. He's
Right,
in the-
and how many cases do we have in Wright County right now?
We have 7 confirmed cases in Wright County.
And are some of them already healed up and back to?
So we updated, I at least was able to copy another county who I know their county attorney was pressing for a legal opinion. So I updated the website this morning. It has, or I didn't, but I directed staff to update it. It has the case count and the number that are off isolation and the number of deaths, which I can happily report remains at 0 for Wright County. That was updated today and will be updated on a weekday basis after we get the reports from MDH. So right now, I think I just opened at 7 cases, 5 recovered.
So I just don't know why that we couldn't handle that kind of a load in with the current staff. So that's my point.
Yep.
Nobody else has data analytics in
Yeah.
the job description.
Yeah, thank you. Yeah, it is different from what other job duties are being done, and I can say that I've observed they're very busy. So,
And I think I failed to mention that the duration for this temporary worker would be, April 1st or 2nd to August 31st or 30, whatever, however many days August has.
31st.
And that would be the duration of this position.
yep. Commissioner Potter?
Thank you, Madam Chair. Commissioner Burrell, normally I'd be with you on that against adding more people, but in this particular case, since it's a part-time, it's a temporary, we have the luxury at the end of August to have that information gathered and see if this continues to go on, and it'll help, in my opinion, it'll help us prepare for the next one of these that comes along to gather some data and see what's going on, see what the trends are. I support this just because I'm seeing the value in this and has minimal cost to the county.
Thank you.
Madam Chair,
Commissioner Delyden?
I like the idea because, as Sarah had said, the state's not forthcoming with the information, and we don't know if it ever will, but it's good for us to have our data on the Wright County, on what's going on. And you said that there were 7 people that have been diagnosed?
We have 7 cases, confirmed cases, correct?
Okay.
That have positive tests.
But not all 7 are healthy. There's still one that's in the hospital, I know for sure.
So what you know from media or public sharing is not necessarily what I can share as the
Okay.
public health director.
Okay.
But I think our report says that 5 are recovered. So we have 7 confirmed cases and 5 are recovered.
I think
Sarah?
off
Sarah?
isolation, they may still have lingering effects, but they
Madam
can go
Chair?
out in public. Yes?
Charlie?
Sarah, I realize you can't share somebody's address or who they are or where they're from, but I think you can say how many are hospitalized. I don't think that's anything public that you can't share.
I'm not sure that I can tell you how many are currently hospitalized by county. I can tell you that we've had cases hospitalized. I've asked this,
I think
we're
maybe-
waiting for a legal
I would
opinion.
I would appreciate you checking into that because I do not believe that that's privileged information. I think that's put out all the time by the state, and I think if they're putting it out by the state, we certainly could say how many there are in the county. And if we can't do stuff like that, what good are these statistics going to be? Right, Charlie.
Well,
I would just add, Commissioner Burrell, that we are waiting for an opinion on this, the legal opinion. The state can put out how many have been hospitalized, how many cases there are, how many are hospitalized, how many deaths, how many are no longer, are considered recovered. They call them recovered, I think, on their website, but they don't
yeah, I'm not sure.
they don't say in what county these people are in. They'll say how many cases per county, but they don't give all the details about the individual counties hospitalized and things, so.
I would tell you, you're not the only commissioner or county board that is frustrated with the, and I'm not the only CHS administrator who's asked for guidance. And we were told Tuesday that we would get a legal opinion this week. I know that there was also a lot of pressure on the commissioner to share around congregate living situations, especially outbreaks in long-term care facilities. And my understanding from the media call today is that they expect to be releasing something in the next 2 days as well. There's a lot of pressure about that information because that's not public either. So my guess is those 2 legal opinions are wrapped up together because it's all about sharing private healthcare information.
Madam Chair, I just
Commissioner
went
Vetch.
back onto the issue at hand here. This is a request for a .375 of an FTE, correct? And it probably has a potential chance for reimbursement on the backside of this
Oh,
potentially.
Yeah.
So, okay. I
Right,
just
yeah.
wanted- all right.
I think that's a very good point to make because a lot of COVID-related activities have potential for reimbursement, so.
I'll make a motion to approve the hiring of a temporary public health worker.
All right.
I'll second that.
Motion made by Commissioner Lyden, seconded by Commissioner Vetch. Any more discussion? Commissioner Burrell, do you have anything else to add?
Just that I'm not in favor of it.
Okay. All right. Anything else? Hearing none, roll call vote.
Aye.
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 Commissioner Burrell?
Nay.
Nay.
Oh, no.
Okay. 4-1.
Anything
Man.
else for me?
Yes. All right.
Put Charlie in that.
Huh? All right. All right, so moving on to scheduling upcoming meetings. Additional COVID-related meeting. We had discussed the 9th of April, I guess. We're having our meeting on the 7th, so do we,
Madam Chair, I just looking that anything that would come from the governor's office is probably going to come out on the 8th or the 9th if they're going to extend the shelter in place. And for that reason, I think if we meet on the 9th, we'll be able to determine if we need to push out our date past April 18th at all, just because waiting to see what the direction is from the governor's office. I very much doubt that we'll hear from the governor's office on April 6th, because when we meet on April 7th in the morning, we probably won't have any more information. They'll wait till later in the week.
Well, either that or you may say something at the state address on Sunday.
Yeah,
That's a possibility.
it's a possibility.
so if we set this meeting for the 9th, we could cancel it on the 7th?
Yes, yes, we could.
That way we wouldn't have, we'd have the
Yeah.
3-day notice for setting this meeting, but we don't need
Don't
the
necessarily-
3-day for canceling
Yep.
it, so, all right.
I'll make a motion to state a meeting for April 9th. Do we want to do 3 o'clock again, or do you want to do it in the morning?
I do have a Zoom meeting in the morning, so at 9.
Afternoon's fine.
Do we, they're doing a teleconference AIS at 2, so are you
I
participating?
thought it was at 9.
Is it at 9?
Maybe I wrote it down
I thought I
wrong.
had it at 2.
Maybe they changed it.
There's,
Sorry
I have it
about
at
that.
2 o'clock, meeting on April 9th at 2 o'clock, yep. So we
do?
can do the morning.
Okay,
Yep.
so, yeah, we could do morning.
The AIS one?
Wait,
It's a Zoom meeting, it's a telecom.
oh, Zoom meeting? Okay,
Yep.
so we
Zoom.
can meet before that?
We can meet, yeah, we could do 1 o'clock, we could do whatever you want to
Or
do.
if you-
10,
Yeah, because it'll be just strictly COVID-19 info, so
Yeah.
yeah, 1 o'clock would be
1 o'clock, okay.
good enough.
Yep.
Okay,
Second.
all right. Motion made by Commissioner Lyden, seconded by Commissioner Potter. Did you hear that, Charlie, to set a board meeting for April 9th at 1 PM
If needed.
Yes, I did, and I'll vote aye.
if needed? Okay. All right. Any more discussion? All right. Roll call vote. Commissioner Potter?
Aye.
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 Commissioner Burrell?
Aye.
Aye, thank you. All right. So the upcoming scheduled meeting, we had a Human Service Board meeting, Health and Human Services Board meeting on the 13th of April. Are we thinking of doing that? Jamie, you want to step up and
yes, I
offer
can.
comments?
You know, right now, everything is kind of, COVID-related regardless, so I did have an email conversation, I guess, with Lee, and I'm fine either way. We can, have things like employee of the month kinds of things that we have, but otherwise, we're fine kind of piggybacking on the board meeting on the 14th, or we don't have a board.
We don't have a board meeting on the 14th.
It's a workshop.
We do have a workshop.
Well, I'd have to say, we may change that too, depending on what occurs next week.
So potentially, we would still have time to piggyback items onto the 9th. And then we have another.
The 9th is a committee of the whole, that's not a county board meeting, so.
I think we're okay with our April
Well, it is.
27th, if we can leave the April 27th HHS board meeting on, and if anything would come up before that. Attach that to another board meeting?
Yeah, I think it should be a board meeting. I think that's the way I stated it.
Is that what we're doing, a board meeting on the 9th?
Because if we have to make decisions, we're going to want to make those decisions.
Okay, sure. So we're gonna do board meeting on the 9th, okay.
Yes, it is, I have it written down as board meeting.
Okay, just to make sure. Not that it matters, I just, so, yeah. Well, it matters for the fact of what we publish it as, yep, perfect.
So if you have items that you'd like,
Put them on the consent agenda for the 9th, and then any leftover items, I believe we can address on the 27th, which is still a standing HHS board meeting.
Okay,
yes,
So we're keeping the 13th board meeting, or no?
We would be canceling the 13th
Okay.
HHS board meeting.
yep,
Okay.
thank you.
Thank you.
All right,
and as far as
Motion.
the 14th workshop,
Shall we-
I'd say let's just wait till Tuesday and kind of make that decision then to see,
Fair enough.
or even we can make that decision too on the 9th. I'd say we'll play it by ear for now.
how about taking action on the 13th board meeting, HHS board meeting?
Oh,
We
Yeah.
need
Oh.
action.
I'll make a motion to cancel the April 13th HHS board meeting.
All right.
Second.
Motion made by Commissioner Glyden, seconded by Commissioner Betch. Is there any more discussion? Hearing none, roll call vote.
Aye.
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 Charlie?
Nobody here.
Commissioner Burrell?
Canceling the,
Sorry, I had the phone. I will vote aye, but I did want to make a point. If we don't have a board meeting on the 14th, I don't think you could schedule one on the 9th. You could check with Greg, but I don't think that's enough notice, is it?
Actually, the motion was to cancel the April 13th Health and Human Services Board meeting.
Right. But there was also talk about having instead of the workshop on the 14th, to have a board meeting. And I said, I don't think you could make that announcement on the 9th. I don't know if that would be a timely notice.
Actually, you might not have, maybe I misunderstood, but actually, the board meeting, we're setting a board meeting for the 9th. And
Right.
we can decide either on the 7th or the 9th whether we'll have a workshop or not on the 14th. And that gives more than 3 days' notice.
to cancel.
Okay, the
We don't even
7th
need
for
to.
sure would. I'm just not sure the 9th would.
Should.
Well, I don't think there's a notice requirement to cancel. To schedule, you have to have 3 days, but to cancel, you don't have to have a 3-day notice, so.
Correct.
Right?
So then, okay, so right now with HHS, then I'll ask my question about the 14th later.
All right. We voted on it already.
Yep, so Madam Chair, now
All
we're
right.
discussing whether the workshop on the 14th,
14th workshop.
and
All
I
right.
guess Commissioner Dulliden's point, I think, is well taken, that we just hold off and make a decision next Tuesday, whether we want to go forward with that or not.
We certainly have items that we can do a Zoom meeting for if we're bringing in a consultant. You know, we can certainly have that via Zoom if we need to, or bring in, that was one potential item, so.
I think the proposed topics of workshop that we have here, which regarding around the jurisdictional change on Braddock Avenue, the 147 segment located in Rockford Township, the EDA discussion in the CMRP, are all valid ones that,
Yeah,
I think keeping that as the template going forward, but then discussing.
yeah, all right. So are you making a motion to?
I'll make a motion, well, we don't even need a motion, we're just going to leave it in place as it is, and we will make it, if we're going to cancel, we'll decide on next week.
Right.
Yeah, and the 147 segment, County Road, is not in Rockford Township, it's in Buffalo Township.
Okay.
Part of it is.
Part of it, yeah. Majority of it's in Buffalo Township.
Yep.
300 feet are in Rockford Township.
So it's technically correct, but not correct, because it's missed in Buffalo.
All right.
Well, it's
So-
just kind of, I just find it interesting that we're going to take something from Buffalo and then we're going to give something to Rockford Township, so it's just.
All right, so moving on. Defer payments for enterprise loan fund with WCEDP.
I'll approach
All
the
right.
bench. This item
Trying to feel like a
stems,
judge.
this item stems from a discussion I had via email with Dwayne Northagen. Just so the board is aware, the Initiative Foundation has deferred payments on their loans for 90 days. He was asking if we wanted to do something similar with the Wright County Enterprise Fund loans for the two outstanding that we have for Plug Technologies and Cowgirl Tough. He was wondering, he hasn't reached out to those two groups yet, but wondered if the board would have the desire to defer payments on that for 90 days.
Madam Chair.
Commissioner Potter?
Thank you, Madam Chair. Both companies have been very diligent on paying on time, and both of those are kind of shut down with this retail environment here, and that the Initiative Foundation okaying this tells me that I have no problem with it, because we're not in any problem with either of these companies. They're outstanding companies within this county, and I would support the deferment of payment for 90 days for these people under this circumstance. Both these are retail environment dependent.
Motion?
And I'd make a motion to allow the deferment of payments up to 90 days from the Enterprise Loan Fund with the Wright County Economic Development Partnership.
All right, motion made by Commissioner Potter. Is there a second?
Second?
Second by Commissioner Vetch?
I thought Charlie did.
Oh, I'm sorry, did you say second, Charlie?
No, I wasn't seconding it, but Madam Chair, I'm not against the motion per se, but I just think we have to be careful, because this was not posted in any of the notice for this meeting today. This was just added on probably today, the way it sounds. And I just think we have to be careful that we're not putting something on the agenda on the motion here that was not on the agenda previously. It's not on the county board at all. When you download the packet, it is not on there.
Can we add this on Tuesday's board meeting?
Okay, that would be.
We can hold off on a
we can-
vote.
Yep. All right.
You want to rescind your
Withdraw your
motion?
I'll
motion.
rescind it.
I'll rescind it. Yep, we
Alright.
can move it on Tuesday. Yep,
We
that's
will-
fine.
We will put this on the board meeting. That's a good point. Thank you, Commissioner Burrell. We will add this to the board meeting on Tuesday.
Thank you, Madam Chair. And like I said, I'm not against it. It's just that I think
Right,
we
yep.
got to make sure
Okay.
we're doing it right.
Yep, thank you.
Madam Chair,
Commissioner Potter?
Commissioner Burrell would make a great parliamentarian.
You see my dream. Look at your screen.
Madam Chair.
Commissioner Glyden?
Can we get a roll call on everybody that's on the phone
There.
or on the speakerphone?
Okay, so we have them for our minutes?
So we have our for records?
All right,
Is my screen showing up?
all right.
Okay. Yeah, beach scene, listening to the commissioners. Yep. I'm in the wrong spot.
Madam
So,
Chair,
yes.
those online, can we get a roll call? Commissioner Burrell, you're on there. Who else is online?
Mark Mattice?
Greg Kreiser?
Greg Kreiser?
Brian Oswald is here as well.
Brian Asleson?
Jill Pooler, did I hear?
Jill, are
Sean
you
Riley?
Sean Riley?
on?
Mark Kellogg?
Mark Kellogg?
Matt Treichler?
Matt Treichler.
Matt Treichler, good.
Okay. Matt Streichler?
Anyone else?
Tony Rasmussen?
Virgil Hawkins?
Virgil Hawkins?
Tony.
Tony
For
Rasmussen?
Rasmussen?
All right,
Steve Jobs?
Steve Job?
Who?
Steve
All
Job? Anyone else? Going once? Going twice? All right.
We got everybody. Thank you for joining us remotely, everyone. Is there any other closing comments? Anyone have anything? Yes, Jamie?
Thank you, Madam Chair. I just wanted to, this is just informational.
Okay.
I'm not asking for positions or anything like that. I just want, if Michelle could just give you some information about some negotiations we're currently in with Sherburne Stearns and Benton counties about the possibility if we have kids in foster care that need to be quarantined, and some of in our homeless population situation. So we have been in conversations. Nothing is settled on yet, but I just wanted to have Michelle give you kind of a heads up about, and potentially I assume it might be a headache for administration and for HR if we need to do some 24/7 staffing.
So Seth and Sarah have also, well, they've been leading this, and Jill Pooler and I have been brought in most recently. And really it's to look at if we have foster kids that are being placed or homeless adults that require isolation or quarantine due to a positive test or being symptomatic. One of the first things that we've done is to poll our foster homes. So I've been mainly looking at the foster care piece of it, to poll our foster homes to find out. We asked actually like a series of 7 different questions around this topic. If a child were exposed or symptomatic or had received a diagnosis and needed placement, would you consider your home being open? And thankfully we've had some homes that said yes to not everything, but multiple things. So I feel like we're sitting in a pretty good place, and we'll just keep updating that list. It seems like over the last couple of weeks, things have changed. We've gotten more information, and so some of these foster homes answers have changed too, given more information. So what our 4-county area is looking at is St. Cloud State campus. That looks like a possibility for kids to be placed there. The issue, of course, is where do staff come from? And that is possibly where we would step up, is have our staff be the 24/7 staff taking care of these kids. A secondary location would be Camp Friendship. So Seth has reached out to them to develop an MOU, and they've been great, but would not want to be the primary, but rather a secondary location if needed. I should back up. The St. Cloud State campus has 9 pods. That doesn't necessarily mean 9 beds. It's pods with multiple beds and a bathroom on multiple floors. So if you had kids with differing levels of exposure versus diagnosis versus symptoms, they could be kept separate. We're also looking at folks who are homeless and symptomatic or have tested positive or been exposed. One of the places that they were looking at is Passages. However, there was like an $86,000 a month bill that would come with use of that facility. So I believe that's been taken. I don't know. Okay. Some of the other options are Place of Hope and Salvation Army that are both in St. Cloud, but they have limited space. So we've also looked at contacting some of our hotels. That's Sarah's staff, Anna, and asking some of them if they'd be willing to host.
So we have been directed by the Minnesota Department of Health that housing symptomatic, exposed, and folks that are homeless, that's our responsibility. So not only are we locating a location for them to be under self-quarantine or isolation should they test positive, we are also working with how do we make sure that those folks get to us from our healthcare providers. We are looking at a location that would be in county. We've been working, Anna is tasked with that, and then we have to provide all of the essential services as designated by state statute to them, which includes food, they have to have phone, clothing, medication, medical care. I would say the list has not been very well defined.
Madam Chair?
Commissioner Delyden.
You know, we do have a facility that's not being used anymore, which...
I did bring that up.
And I don't know what it would take. And you know, and I don't know if it's viable or not, but you talk about keeping people separated.
Yeah.
I mean, they each have their own restroom.
There's a lot of,
I don't think it's openable that
iron
easy.
wall between, yeah.
Again,
I wonder how that would play in the media, just saying.
Just
I
say,
actually heard that.
I'll provide the flowers, that we'll put flowers in each one or something, but,
Put an Xbox.
hey, you know, it's an option. If you're homeless, at least you're out of the elements, or,
If I may, if it comes to a facility that big, the Army Corps of Engineers, FEMA, and the Department of Health will be involved, and if they deem something like that many beds, they will come to us on the backside, but it'll be an overnight decision. They'll be really sensitive about that being perceived. Not saying it's out of the realm, and we know it's not, right? But it's an optical piece. So like the Army Corps and public health and some doctor boards and stuff already went out and like a couple facilities in the county, and Camp Courage is one of them, and it sounds like that might be a viable option that they're going to use for some beds to remove people from hospitals that don't have any COVID symptoms, and they can recover out there and free up hospitals. They're already looking at all these possibilities, but if it's a big facility like that, the Army Corps and the feds are going to come in.
They'll
Poke their nose in.
kind of help make that, or they'll make
Yep.
that decision.
Yeah, which takes us kind of out of it.
yeah, and that's fine, just as long as people are aware that it's an option. I mean, I know
We had
out,
to give a list of options, I'm assuming that might be on the list.
I know out west, on that facility that was privately ran,
Appleton.
Appleton,
Yeah.
I know that's been looked at. So, I'm just saying,
Yeah, I mean, it's
It's-
a great idea, I just don't.
I understand that, but
Right.
again, we could make it a little bit so that it wasn't so jail-like. I mean, it's,
You'd be interested in the things that are important to the Army Corps.
Yeah, some of the things you wouldn't.
yeah, well, I know dealing them with dikes and stuff like that regarding,
Right. What I thought would have been a very good
versus-
facility for them was the Camp Friendship one, because it seemed to be a lot newer, nicer. This was a hard no versus Camp Courage, where they could do some other things they wanted to do. Whatever, but they also said that didn't preclude us from using it for local planning purposes.
Sure.
So that's why then I did reach out.
Which circles back to staffing it. And so my hope is after the board meeting today is to send out an email to our staff to find out people who would voluntarily sign up to staff something like this. Our hope is that we don't have to, and that our foster homes are able to, that we don't even come up against this. But if we do, we need to be at least somewhat prepared.
Yeah, I really appreciate that because, I mean, like I mentioned before, the way that everyone deployed in this emergency was amazing, you know, so I credit you for that.
Madam Chair, I just want to know, I mean, fine by going out there getting that list, I just want to know if or when that happens. I want to
I'd like to know too.
yeah, so I just don't want to say we get this and then all of a sudden it's taking place and I have no idea. I'd like to know.
Right,
Yeah, the
no,
minute, like we were talking about this, if Camp Friendship opens, we will let you guys know, and we'll probably let the city of Clearwater and Annandale know. In their
Sure.
vicinity to keep people informed of what's
Yep.
happening.
Sure.
Yep.
I think Seth and I have the similar concerns that we might not know until it's already happening, that they're standing on stuff.
right, yeah.
Sure.
And that, I mean, and that's understandable. I mean, when you might not find out until sort of after the fact, but,
then we can say, well, it was the Corps that did it.
right.
I just want to know if we're housing
Was it
foster
Wright
kids at
County?
St. Cloud State, I want to know that we're doing that. That's
I would assume that
Yeah.
would, because of the staffing implications.
Yep.
All right, well, good. I mean, it's, you know, one more step and one more thing to consider and to work on, so.
All right.
It's ever evolving.
Madam Chair,
Commissioner Deline?
before Sarah goes away, do you have anything to add from the governor's update today or anything?
Fortunately, I didn't get to hear all of it because I was in another meeting, but my understanding is, like I mentioned the piece already about the long-term care homes. I think that is going to be interesting. I don't know if that, honestly, I'm on a little bit of an information delay on some of our most recent
Well,
cases.
I did hear that of the 18 deaths in Minnesota, 11 are related to congregate care, so that's a pretty high number.
Right.
Yeah.
But whether that has impacts to Wright County, I can tell you right now, I'm in the middle of an information delay myself, so I can't tell you if that's going to be illuminating. It may be something that you and I find out at the same time. As I mentioned, we're trying to figure out how we can get some of that information out. I wanted the communication, we've redone our ICS structure again because we are really wanting to focus on some partner engagement. I know that Jamie got a communication just recently on food insecurity resources and the possibility of some pretty interesting.
I thought you were going to say about the Zion Church wanting to hold Easter
No, that's
services in
kind
the
of-
parking lot.
Oh,
Yeah, I haven't followed up with that. So we're focusing on a couple of different strategies. One is partner engagement, so making sure, and that includes you folks. So as you know, this has been a very fluid response, and we have been expanding and adjusting our incident command structure as things develop. So at one point last week, we thought we were getting we would be getting all the cases and we would be doing the case investigations, so we stood up that part of our structure. Then they pulled it back. Now it's been told that we're not going to be getting that information. They're continuing to manage it at the state level. So we had to redirect those individuals. So it's just been a piece of kind of figuring out that and getting at the places where we know that we have some gaps and have spent some time around that. So I hope that you will have I've just finished the ICS structure way over here, so I can give you an update.
And I just wanted to, this goes back to Commissioner Potter's very first comment about the public contacting you about, layoff versus, keeping everybody on board. And Christine Partlow had just tallied up our hours for the last pay period, or I think through this, one of the pay periods. And I thought it was kind of high. She said there were 632 non-work related or non-work related hours, COVID hours. So people that are home not working. And I thought, well, that's a lot of 600 is a lot of hours. But then I thought out of 240 some staff, that's only like 2 or 3 non-work hours per staff over that entire period. And I'm assuming that's because they were working with kids or, they had an appointment or something like that. So I think overall our HHS staff have been working this entire time, when I think of that relatively few non-work hours if you do it by a person basis.
We are providing our time related to COVID in public health and our public health response to AMC, Marcia, and the fiscal technology staff have been super helpful in helping with that because they're using that to go to the legislature to advocate for more funding, and we doubled the amount of time from last. That number on my way here.
yeah. Thank you for everything. Any other comments by anyone? All right, hearing none, we will adjourn 3:50. Thank you.